All right, I have Dr. Balgobin with us today. Dr. Balgobin is from, or Dr. BBL, we call him Dr. BBL as well, from Minnesota.
Minneapolis, Minnesota, yep.
Minneapolis, Minnesota. His primary specialty is kind of like the BBL, right? The buttocks enlargement and shaping and so forth that a lot of women do. However, he has ventured into a different world. He's entered into my world where we're doing male enhancement. So Dr. BBL is here. He actually had a procedure done too, and he's learning how to do the procedure. So he's learning. He's going to start his practice when? When are you going to start treating men?
As soon as possible.
As soon as possible. That's good. I like to hear that.
Yeah.
Now, Dr. BBL is here today because he's continuing his learning, right? We have to train all the doctors that do this and train them well. And then he'll just hit the ground running when he gets back to the office and so forth. So tell me, we're going to digress a little bit. Now, we'll talk about male enhancement and stuff and your procedure.
Mm-hmm.
But tell me a little about your history. Like, for example, you're doing the behinds primarily,
yes.
right? All right, so tell me what the process is when you do a BBL.
So with a BBL, it's very time intensive. So my patients are under general anesthesia. They're asleep. They're intubated. So I'm doing liposuction of the entire torso, so the upper lower abdomen, the upper lower back, and their flanks, their sides. I'm taking that fat, purifying it, and then injecting it into their hips and buttock to give them that nice shape. So my goal is to create an hourglass silhouette appearance.
Now, how much fluid, how much fat are you taking?
The maximum I can take legally in the state of Minnesota is actually 5 liters.
5 liters?
5 liters of fat in Minnesota. It's about 11 pounds. The most I've put in a butt is about 4 liters. But the average can be anywhere from about 2 to 3 liters of fat. This last week I put 3 liters of fat in each woman's butt. And they could take it. Like, they had the shape. The skin was lax, so they could take more volume. And, of course, I'm always discussing with my patients ahead of time what's their goals. What are they shooting for? Sometimes they'll bring in wish pics. Sometimes you have to disappoint them. But, yeah, I can look at a woman now and be able to say, this is what you need. And usually I'm spot on. Been doing this for so long now.
Let's say you're moving 3 liters, how much is it going to take?
So we say about 70 to 80% will take.
Okay, that's high.
Yeah, that's pretty high. If you overfill, your take will be less because you need that good blood supply. You need that oxygen to help with the fat cells. If they smoke, forget about it. They're going to lose those cells.
Really, it's that bad?
Because they're constricting those blood vessels. That nicotine is just constricting blood flow. If they sit on it or put pressure on it, that's another reason that displacement, death of cells. So we have a whole protocol about what they need to do after these procedures.
It's interesting. The process that Dr. BBL is using is also used for male enhancement. For years and years, they've used fat transfer for male enhancement. And that's a good method. I don't really knock it. However, our treatment and what we use, we have collagen generation, which is denser tissue. So fat's good for the behind because it has to be kind of soft. But in the penis, I had a patient say his wife called him a gummy bear because it was kind of soft. You know what I'm saying?
Yeah.
With the fat transfer. So, but now that you have a process here with a filler formula, a permanent filler formula that generates collagen, you have firmness. Now, from your experience so far, because we did one treatment, I know we're really lying to maybe do another one soon. But let's just switch gears for a second. And let's talk about your experience, starting with the procedure itself.
Yeah. Procedure was extremely comfortable. When you have, and you're exposed, and you have your genitalia out, you don't know what's going to happen. Especially as a man, you're kind of like, we haven't had babies. We don't know what to expect, right? We're very kind of reserved. But the numbing was wonderful, right? You had the nitrous oxygen available for me.
We had the numbing cream first.
Yep, numbing cream.
Then when we start a few injections, we have a little nitrous if you want
little
it.
nitrous.
That's the laughing gas.
Yep.
Uh-huh.
I actually didn't want the nitrous after a while because I'm like, this is tolerable. And then once you're numb, it feels heavy. There's no pain. Yeah. You guys could have did whatever you wanted to it. I didn't even know. It didn't even feel like part of my body.
Well, that's right. That's the idea. That's the idea.
And I was there just laying back. I think I fell asleep a few times.
You may have, but we were chatting too.
Yeah.
I remember chatting. But we had a good amount of filler in you, I remember.
Yep.
Okay. So then you healed, right? Healing process is a little cumbersome sometimes, but how did you do with that?
So that's the hardest part is the compliance, right?
Yeah.
Wearing that wrap 21 days, that good fitted wrap, and then doing the looser wrap for the 90 days. I'm married. So when you're married, you have kind of things you do with your wife that, are more routine. Going 35 days without sex is a long time for a married man.
Yes.
And so it becomes very difficult. And not only for me, but for my wife, too. So
But you did comply.
I did comply.
Oh, okay, just making sure.
I did comply. The hardest part, I think, for men, and I tell this when I do my consults with them, is the post. It's going to be your compliance. That is the key to this procedure.
That's right.
Because we're doing the procedure on you. We know what you look like on the table. However, when you leave the table, how is your results going to look? It's all about how are you going to comply.
No, I agree, and I say the same thing. We have to even monitor them. I tell them, take pictures.
Yep.
When you change the wrap, we have to look at your wrap. We'll take pictures of your skin for healing, take pictures of your wrap to make sure you're wrapping correctly. We just have to be on top of everything.
My wife was great at wrapping.
Oh, so you had. That's good.
Yeah,
that she
my
did
wife
that.
became an expert at wrapping.
I bet.
Because for me to try to wrap it, and I do surgery all day, right?
Yeah.
So I'm wearing a wrap in surgery.
That's right.
My nurses are looking to see what is going on down there. But definitely, as far as the results, I would tell this to any couple. Your man will feel so confident. I said this to my staff. I said this to my business partner. I said, I finally feel like my penis matches me. Meaning that I'm a bigger, buffier
Stocky
guy, right?
Yeah, exactly.
I want my body parts to match who I am.
Yeah.
And even though I'm married, I've been married a long time, and my wife said, you don't need this. They always say that. But now with the new enhanced version of me, she's not complaining.
Not at all, I bet.
At all.
Yeah.
Enjoys it.
Yeah.
Our sex life has heightened because of it.
Yeah, it kind of rekindles. It's
it
like
does.
dating all over again.
Yes. As I was just talking to this last patient. Yeah. He's been married 25 years. It rekindles a marriage. Yeah. It rekindles a relationship. I mean, women do things for themselves, right? And as men, we help them along, whether it be breast implants, tummy tucks, Brazilian butt lift,
fillers,
right?
Facial
all of it.
stuff. I mean, they got head to toe.
Yeah.
What do we want? We
what
want
do
some
we want?
hair and a bigger penis. That's what we want, right?
Maybe a new car.
But those are the two cosmetic
But that's the
things.
things.
Basic.
That's what drives men. Yeah.
Whatever. Our lips are orange. You know what I'm saying? So, yeah.
But I'll tell you what's happening in my practice, being that I'm a female-driven practice, is the women are starting to bring in their men. Oh. Because the women are saying to their men, I'm doing this for you. I need you to do this for me. Wow. And that's kind of an interesting spin on it. And the men are now willing to comply because they want to keep that relationship. And I tell men, there's nothing to be ashamed of. It's nothing to be afraid of. And I kind of tell them what normal ranges are because I think they're all distorted about what they think the normal is.
Yeah, pornography has polluted our minds.
All of it.
I mean, it's not,
all
not
of
realistic.
It.
It's
Not every man out there is 8 inches. Not every man out there is 7 inches in girth. They're not.
No.
Right? No. The average male is, 4.5 inches erect?
The Loria Medical male is different.
Right, the Loria Medical is different, right. But the
different
average male size is very different. And when you tell people this, even medical professionals, they didn't know that.
Yeah. And the stereotype of black guys.
I get a lot of black men.
Boy.
Why do I get a lot of black men?
There's a lot of black men are small.
Black men will tell me. Black men will tell me. I have to live up to the stereotype.
That's right.
Which is a sad thing. My practice has an influx of Latino and black men consulting with me.
Yeah.
Right?
Yeah.
Again, one man said to me straight direct, and he had a good-sized penis, flaccid. He said, it's the stereotype.
That's right.
I have to keep up with the stereotype. And he's a single man.
I have a funny story to tell you. I had a patient who was a black male. We did a couple of procedures. So he had a good size, sizable girth and so forth. His erect length was like 6.5. Okay. So he's with this lady, and he has his erection, right? The lady's there. He has his erection, and she says, where's the rest of it? She expected something to expand out to who knows what and so forth. Yeah. So he didn't feel too good about it. But he didn't, he was okay with it, but not such a great thing. I mean, some women expect bigger or whatever the case is with the stereotype and so forth. But a lot of stories like that. But getting back to those women talking to their men, because it's a very touchy thing. Imagine your woman coming up to you and saying, can you get a little bigger down there? It's like asking a woman, can you tighten your vagina? You don't say it. Usually you won't tell a woman that, right? But I mean, I'm all for it. And I think if they're honest and the men could handle it, because their self-esteem is affected, right? It might become an issue. They might feel bad. They might hurt their feelings. But you know what? In the long run, it's phenomenal.
Yeah.
It helps them all.
And we have ways now to treat you. We have ways now to help you. You don't have to suffer in silence anymore.
Yeah.
And it really is. It is such an ego thing. It is such a confidence thing and self-esteem, and we have the means to help you through that.
Very effective means.
Very extremely.
And we're developing other techniques for lengthening too. So we have the girth. I mean, I have guys. I mean, I'm almost this size already. This size. I mean, I have guys the size of this. Believe it or not.
Yeah.
Okay. And I don't recommend it.
No.
But being in practice now 13 years, they keep on coming back. I didn't know. Starting 13 years ago, they're going to come back 10 times.
Right.
And we're like up to here.
Yeah.
This kind of sizes. I mean, it's unbelievable. It's a tremendous tissue builder. I mean, it just keeps on building. I only have 5 of those guys roaming the earth right now, so that's not a big deal.
Yeah.
You know what I'm saying? Well, listen, my friend, it's good to see you. Okay, we'll chat again.
Yes, for
Okay,
sure.
a lot of stuff to follow up on. And for the audience there, just keep in tune, keep in touch, and we'll have some more interesting podcasts for you.